Lung Association. And so I want to thank the Nova Scotia Lung Association for convening this meeting today and for all the work that's gone into it. Lacey and your team, great job. And thank you for inviting me to be here today to talk a little bit about climate change and air quality and some of the work that we do at the New Brunswick Lung Association. So I'll just add on to what Lacey said in terms of acknowledging the land that we're on. I'm joining you today from the ancestral homelands of the Wolastoqey and the Mi'kmaq and Passamaquoddy peoples. At the New Brunswick Lung Association, we strive for respectful relationships with all people, and we're searching for collective healing and reconciliation as we honor this land together. Why is this not going to the next? There we go. All right, so climate change has been deemed by the Lancet, which is a medical publication, as the greatest threat to global health in the 21st century. And so this has been an area that's been a little bit hard to, a pill that's hard to swallow, given that we've been in the midst of a global pandemic for the past 2 years. But really the threat of climate change is actually more severe and is not going away anytime soon. So when we talk about effects of climate change on air quality, I'm just going to minimize that there so it's not so distracting. Lots of different effects that climate change can have on air quality. We have a longer growing season, a longer pollen season. So anybody that has seasonal allergies, such as myself, you may have noticed that your seasonal allergies are lasting a lot longer than they ever used to. And that's partially related to these longer growing seasons that we have as a result of warmer climates. The warmer temperatures are also more hospitable to mold and mildew, also culprits of allergies. And with these warmer temperatures come a more intense wildfire season, which releases a lot of particulate matter into the air, smoke and so on. So these are all physical effects, physical debris that can get into our lungs. Also, with the warmer days comes an increase in ozone production. That's formed in the atmosphere when light hits VOCs that are naturally in the air. And also that hot, humid, stagnant air traps pollutants closer to the ground, closer to where we're breathing them. And the humidity is also a culprit in keeping all that pollution close to where we're breathing. Now, air pollution has been deemed the biggest environmental risk to human health by the World Health Organization. And that's sometimes hard to wrap our head around in Atlantic Canada, where our air is generally quite clean. However, there are lots of different sources of air pollution. Transportation and fossil fuel burning, of course, is a big contributor here. Electricity generation is not always not emitting. In New Brunswick, we're quite fortunate where it's primarily non-emitting, but if you're relying on things like coal for your electricity, that's also a source of air pollution. Metal refining, cement, the creation of cement, combustion of any sources, so whether that's transportation and combusting fossil fuels or transportation or within your own homes, wildfires. And then we're also at risk of movement of pollution from other areas of the country. We're not just Atlantic Canada in our little bubble here. We have movement of pollutants from the eastern seaboard and also from central Canada as well. So when we talk about air pollution, it's mostly the NOx, the nitrogen oxides, particulates, and the ozone that's of greatest concern. Drilling down a little bit further into particulate air pollution, we have a image here on the right, just to give you an idea of scale if you're not familiar with this stuff. We talk a lot about particulate matter of size less than 10 microns in diameter, so PM10, and also PM2.5, which is even smaller, so less than 2.5 microns across. These particulates are released from forest fires. Pollen falls into the PM10 category. Wood burning, whether it's furnaces, campfires, wood stoves, they all release fine particulate matter. Construction, road dust, agriculture are all sources of particulate pollution that can be either localized or be transported over long distances. And when we talk about particulate matter, there's a growing body of evidence that the threat from particulate matter on human health has been classically underestimated. So the World Health Organization in early 2021 estimates that particulate matter results in about 34,000 deaths in Canada each year. And that's premature deaths. And the biggest distinction here is that this new research in 2021 has designated PM as a non-threshold dose response. So what that means in non-medical terms is things that have a threshold response. You can be exposed to a small concentration. The concentration is different depending on which compound we're talking about. But you can be exposed to small concentrations without any ill effect. A non-threshold response, conversely, is any exposure increases your risk of negative health outcomes. So analogous to a cancer-causing agent, we say that every exposure to that carcinogen increases your risk of developing cancer. So with every exposure to particulate matter, you increase your risk of negative health outcomes. So because of that, the World Health Organization has reduced their guideline for annual PM 2.5. They've raked it back from 10 micrograms per cubic meter to 5. When we talk about the state of the air in Canada, based on most recent CCME, so the Canadian Council of Ministers of the Environment, they have really great resources on their website if you're not familiar with them. Based on a standard that we have been using of 8.8 micrograms per cubic meter, so remember that the World Health Organization has just ratcheted their recommendation down to 5, our studies show that over 30% of Canadians live in areas of poor air quality. And Health Canada attributes about 15,000 premature deaths annually to air pollution. What does all that air pollution mean for lung health? Lots of challenges. So elevated morbidity. We've got increased hospitalizations, increase in asthma symptom days, cardiac ER visits, bronchitis episodes, acute respiratory symptom days, restricted activity days can all be tracked back to air pollution levels in our environment. And when we're living in polluted air, we are chronically exposed to these pollutants. So the PMs that we talked about, the NOx, the environmentally persistent free radicals, which is your ozone, and that causes within the lungs an inflammation response. We will respond to these irritants. The bronchioles can constrict. Some of those particles are actually retained in the lung tissue. Some of them are small enough that they pass right into the blood, and that can cause cell damage and death. And there's actually a growing body of evidence that epigenetic effects are possible. So that means effects on a body that are hereditarily changed. So can affect the next generation based on the pollution that the parent was exposed to. And for children, it's even more dire. Children are in a period of rapid development. So their organs are going through changes. And they have weight per weight a higher body burden of pollution. They also breathe weight per weight more than an adult does. So all that pollution can affect the development of the organs, can decrease their lung function. There's evidence that it increases asthma incidence. And even if you take a step back to the previous generation, a mother exposed to air pollution has a higher risk of lower birth weight, which has a host of, which leads to a host of other risk factors for that child throughout their life. And here's our famous coronavirus. As we are exposed to air pollution, we actually have changes in our physiological response to viruses. So we have an upregulation of this ACE2 receptor in response to PM 2.5 pollution, which actually is the receptor for the COVID-19 spike proteins. So we can see that areas that have been heavily polluted, a lot of air pollution, have a higher frequency of severe COVID-19 cases. This was particularly apparent in the early days of the pandemic when this was cropping up sort of in isolated areas, and less so now. So I'd be remiss not to speak about the Air Quality Health Index today. Just being mindful of the time here. Air Quality Health Index is a tool that was developed in tandem with Environment Canada and Health Canada, and my predecessors at the Lung Association in Brunswick were part of these teams that takes into account the forecasted risk, cumulative risk, of a number of health affecting pollutants, the ozones, the particulate matters, and the NOx, and ranks it on a scale of 1 to 10. So this gives us a consistent air quality health index risk forecast across the country. It's a really, really handy tool. So I took this screenshot last week when I was putting my slides together. And so you can see on the right, the Fredericton's Air Quality Health Index for Wednesday into Thursday continues to be a 2 or 3, which remains low risk. When we say low risk, we actually have consistent messaging for the general population and the at-risk population. So an AQHI value of 1 to 3, which is where Fredericton generally sits, is ideal air quality for outdoor activities for the general population. And even for those at risk, we can continue to enjoy your usual outdoor activities. As the pollutant levels rise, excuse me, you'll see that there's a little bit of a difference for the at-risk population compared to the general population. And what we strive to do when in AQHI education is to help lung health patients to identify at what number they have an issue. So you may be okay at a 4, but at a 5 is when you personally need to consider reducing or rescheduling your strenuous activities outdoors. So that's a very handy tool that we have at our disposal. Talk a little bit about what the New Brunswick Lung Association is doing in a couple of different areas of air quality as they relate to climate change. So I know Celine Audette will be on the call. I don't know if she's on today, but will be on tomorrow to speak a little bit about PM 2.5 as well. This is a project that we've been doing with Celine's group at Environment Canada, where we have a number of these small portable PM 2.5 sensors that we have recruited citizen scientists across the province to host. We're continuing to develop this program and seek out more hosts. So on the right, you can see this is the data from the brand name is Purple Air monitors. The diamonds are the NAP stations, the National Air Pollutant Surveillance System stations. So there's a handful of those in the province, and it's hard to zoom in and grab a great screenshot as we get more and more of these purple airs across the province, but the circles are our citizen scientists. So we've got a few up here in Edmundston and kind of across the province. If you're down here in St. John, the Fredericton area are quite heavily populated with these. And what that allows us to do is to see data in near real time. They're hourly averaged PM 2.5 observations. And what Environment Canada has been working on for a number of years is sort of co-locating these small, relatively inexpensive portable monitors with the NAP stations. And we've found that the purple air seem to be relatively reliable. And so they do, if I could zoom in here on Fredericton, we would see that the NAP station in downtown Fredericton is reading similar to what my house is across the river on the north side. But the increased density of the surveillance system allows us to have a little bit more of an understanding of the effects of local topography and air quality on air health. And when we have an event like a forest fire event like we had last year, in the summer, we had smoke that was transported from the west. And our air quality forecasters in Environment Canada were able to tell us that smoke is coming to our province, and we were able to reach out to our citizen scientists and gather a lot of really informative data on the ground about the variation between the sensors that were in different locations. We do a lot of public education as well. So here is my colleague Elise, I think she's on the call. She zoomed herself into a number of elementary school classrooms last year for Clean Air Day. and brought to them age appropriate activities to understand PM 2.5 specifically, but air quality in general, the effects that they can have on their local air quality, and how to protect themselves from poor air quality on days when the AQHI is high. We also run a number of informational social media campaigns with infographics such as that on the left. This one is one of my favorites. It's got just a very simple representation of some of the harms that come with wood smoke as we work to educate people on the health risks of burning wood for home heating, and also backyard burning and wildfires. For a number of years, we've been running a program to increase electric vehicle adoption in our province in general. We sit on the electric vehicle advisory group for New Brunswick, and have been instrumental in some of the key policy changes that are helping to overcome the barriers to widespread EV adoption in our region. And we are pretty delighted that we were successful in a funding application with Natural Resources Canada to expand our efforts to an Atlantic scale. So this is a screenshot of our brand new website that serves as a hub for all things EV in the region. And it's a work in progress. If you've got resources that you'd like us to feature here, just certainly reach out. And I know Brandon from the Clean Foundation is going to speak a little bit more after the break about specific positive impacts of EVs in Nova Scotia. We run another project that's trying to leverage health professionals in reaching out to a wide variety of individuals across our province. We've created a network called Health Professionals for Action on Climate Change, where we have developed a number of resources, networking opportunities, but mostly the driving force behind this is a climate change module for nursing students. We brought it into a number of nursing classes. And we have worked to integrate traditional knowledge about how climate, the environment, and human health are completely interlinked, and how protecting one protects the other. And so with that, that's the end for me. If anybody has any questions about any of that, I'd be more than happy to take questions